Drug of choice for ectopic pregnancy. Methotrexate. Drug of choice for induction of labor. Oxytocin. Drug of choice for postpartum hemorrhage in pregnancy. Oxytocin. Drug of choice for hypertension in pregnancy. Alpha-methyl-dopa. Drug of choice for endometriosis in pregnancy. Danazol. Drug of choice for asthma in pregnancy. Beta-2 agonists. Drug of choice for postpartum breast engorgement in pregnancy. Oxytocin. Drug of choice for seizures and eclampsia in pregnancy. Magnesium sulfate. Drug of choice in seizures during pregnancy. Phenobarbital. Drug of choice for the hypertensive emergency in pregnancy. Labetalol. Drug of choice for postpartum hemorrhage in pregnancy. Oxytocin. Drug of choice for falciparum malaria in pregnancy. Quinine. Drug of choice for cerebral malaria in pregnancy. Quinine. Drug of choice for gonorrhea in pregnancy. Penicillin or ceftriaxone. Drug of choice for toxoplasmosis in pregnancy. Spiramycin. Drug of choice for malaria in pregnancy. Chloroquine. Drug of choice for acne. Erythromycin, oral, or benzylbenzoate, topical. Drug of choice for epilepsy in pregnancy. Phenobarbital. Drug of choice for mania in pregnancy. Olanzapine. Drug of choice for hyperthyroidism in pregnancy. Propylthiouracil. Drug of choice for hypothyroidism in pregnancy. Levothyroxine. Drug of choice for bacterial vaginosis in first trimester. Clindamycin. Drug of choice cholera in pregnancy. Furazolidone. Drug of choice for typhoid fever in pregnancy. Ceftriaxone or ampicillin. Drug of choice for amoebiasis in pregnancy. Metronidazole, contraindicated in first trimester. Drug of choice for amoebiasis in first trimester. Furazolidone. Drug of choice deep vein thrombosis. Heparin. Drug of choice for preventing neural tube defect in pregnancy. Folic acid. Drug of choice for anticoagulation in pregnancy. Heparin. Drug of choice for mania during pregnancy. Lithium. Drug of choice for myasthenia gravis in pregnancy. Neostigmine. Drug of choice for thrombophlebitis in pregnancy. Aspirin. Drug of choice for urinary tract infection during pregnancy. Ampicillin. Drug of choice for HIV in pregnancy. Zidovudine and nevirapine. Drug of choice for resistant typhoid in pregnancy. Ceftriaxone. Drug of choice for tuberculosis in pregnancy. Isoniazid with rifampicin. Drug of choice for vitamin B12 deficiency in pregnancy. Cinacobalamin. Drug of choice for iron deficiency in pregnancy. Ferrous sulfate. Drug of choice for antiplatelet action in pregnancy. Aspirin. Drug of choice for anxiety in pregnancy. Benzodiazepines. Drug of choice for pain in pregnancy. Aspirin or paracetamol. Drug of choice for depression in pregnancy. Tricyclic antidepressant. Drug of choice for superficial thrombophlebitis in pregnancy. Aspirin. Drug of choice for bacterial vaginosis in first trimester in pregnancy. Clindamycin. Drug of choice for rosacea in pregnancy. NSAIDs. Drug of choice for seizures in pregnancy. Benzodiazepines. Drug of choice for seizure maintenance in pregnancy. Phenobarbital. Drug of choice for rheumatoid arthritis in pregnancy. Aspirin. Drug of choice for schizophrenia in pregnancy. Phenothiazines like haloperidol. Drug of choice for seborrheic dermatitis in pregnancy. Salicylic acid. Drug of choice for psoriasis in pregnancy. Topical corticosteroids or salicylic acid. Drug of choice for Shigella dysentery in pregnancy. Ampicillin. Drug of choice for paracetamol poisoning. N-acetylcysteine. Drug of choice for organophosphate poisoning. Atropine. Drug of choice for methotrexate toxicity. Folinic acid. Drug of choice for ethylene glycol poisoning. Fomepizole. Drug of choice for warfarin poisoning. Vitamin K. Drug of choice for heparin poisoning. Potassium sulfate. Drug of choice for acute mercury. Dimercaprol. Drug of choice for theophylline poisoning. Beta blockers like metoprolol. Drug of choice for iron poisoning. Deferoxamine. Drug of choice for copper poisoning. D-penicillamine or zinc acetate. Drug of choice for acute arsenic poisoning. Dimercaprol. Drug of choice for carbamate poisoning. Atropine. Drug of choice for calcium channel blocker poisoning. Calcium with glucagon. Drug of choice for lead poisoning. Dimercaptosuccinic acid, DMSA. Drug of choice for anticholinergic drug poisoning. Physostigmine. Drug of choice for methylxanthines poisoning. Beta blocker like propranolol. Drug of choice for ergot alkaloid poisoning. Sodium nitroprusside. Drug of choice for alpha-1 agonist poisoning. Phentolamine. Drug of choice for beta-2 agonist poisoning. Propranolol. Drug of choice for carbon dioxide poisoning. Hyperbaric oxygen. Drug of choice for chronic mercury poisoning. N-acetylpenicillamine. Drug of choice for beta blocker poisoning. Glucagon. Drug of choice for antipsychotic poisoning. Sodium bicarbonate with lidocaine. Drug of choice for isoniazid poisoning. Vitamin B6. Drug of choice for cyanide poisoning. Amyl nitrate. Drug of choice for opioid overdose. Naloxone. Drug of choice for aspirin poisoning. Vitamin K fresh frozen plasma. Drug of choice for benzodiazepines poisoning. Flumazenol. Drug of choice for iodine poisoning. Starch. Drug of choice for torsades de pointes. Magnesium sulfate. Drug of choice for dyslipidemia. HMG-CoA reductase inhibitors. Drug of choice for hypertriglyceridemia. Fibric acid. Drug of choice for myocardial infarction pain. Morphine. Drug of choice for mild hypertension. Diuretics. Drug of choice for the hypertensive crisis. Nitroprusside. Drug of choice for hypertension with BPH. Prazosin. Drug of choice for hypertension with ischemic heart disease. Beta blockers like atenolol, metoprolol, propranolol. Drug of choice for hypertension with diabetes mellitus. CE inhibitors like captopril. Drug of choice for hypertension with diabetic nephropathy. CE inhibitors, captopril, etc. Drug of choice for hypertension in young patients. CE inhibitors like captopril. Drug of choice for unilateral artery stenosis. CE inhibitors like captopril. Drug of choice for hypertension with renal disease. CE inhibitors like captopril. Drug of choice for hypertension and congestive heart failure, CHF. CE inhibitors like captopril. Drug of choice for hypertension and non-diabetic proteinuria. CE inhibitors like captopril. Drug of choice for hypertension and asthma. CE inhibitors like captopril. Drug of choice for hypertension in patients with ischemic heart disease. Beta blockers, atenolol, metoprolol, propranolol. Drug of choice for isolated systolic hypertension. Calcium channel blockers, amlodipine. Drug of choice for low renin hypertension. calcium channel blockers, amlodipine. Drug of choice for hypertension with bronchial asthma. CE inhibitors or calcium channel blockers. Drug of choice for hypertension with chronic kidney disease, CKD. CE inhibitors like captopril. Drug of choice for hypertension preferred in older patients. Thiazides. Drug of choice for digoxin overdose. Digifab or Digibind. Drug of choice for Group B streptococcal infection. Ampicillin. Drug of choice for endocarditis. Amoxicillin. Drug of choice for digoxin toxicity. Potassium. First-line drug of choice for congestive heart failure. CE inhibitors, captopril and enalapril. Drug of choice for rapid-fast diuresis. Loop diuretics like furosemide. Drug of choice for multifocal atrial tachycardia. Verapamil, calcium channel blocker. Drug of choice for paroxysmal supraventricular tachycardia, PSVT. Adenosine, antiarrhythmic agent. Drug of choice for supraventricular tachycardia, SVT. Verapamil. Drug of choice for digitalis-induced ventricular arrhythmia. Lignocaine, antiarrhythmic agent. Drug of choice for ventricular arrhythmias. Lidocaine. Drug of choice for ventricular tachycardia and fibrillation. Lidocaine. Drug of choice for ventricular extrasystole. Beta blocker atenolol. Drug of choice for atrial fibrillation. Digitalis. Drug of choice for maintaining sinus rhythm. Amiodarone, antiarrhythmic agent. Drug of choice for Wolff-Parkinson-White syndrome. Procainamide or amiodarone. Drug of choice for digitalis-induced arrhythmia. Lignocaine. Drug of choice for acute left ventricular failure. I.V. furosemide. Drug of choice for the scleroderma-induced hypertensive crisis. CE inhibitors. Drug of choice for acute long QT syndrome. Magnesium sulfate. Drug of choice for congenital long QT syndrome. Beta blocker, metoprolol, atenolol. Drug of choice for hypertension with peripheral vascular disease. Calcium channel blockers. Drug of choice for the hypertensive emergency. Sodium nitroprusside, vasodilator. Drug of choice for malignant hypertension. Nitroprusside, vasodilator. Drug of choice for producing controlled hypotension. Sodium nitroprusside. Drug of choice for pulmonary hypertension. Bosentan. Drug of choice for atrial flutter and fibrillation. Ibutylide. Drug of choice for paradoxical tachycardia. Digoxin, digitalis glycosides. Drug of choice for angina. Nitrates, vasodilator. Drug of choice for prophylaxis of stable angina. Beta blockers like atenolol. Drug of choice for variant angina. Calcium channel blockers like verapamil. Drug of choice for diabetic dyslipidemia. Statins like atorvastatin, rosuvastatin. Drug of choice for dis-beta lipoproteinemia. Fibrates, fenofibrates. Drug of choice for severe hypercholesterolemia. Nicotinic acid. Drug of choice for severe hypercholesterolemia. Rosuvastatin, statin. Drug of choice for lowering TAG levels. Fibrates. Drug of choice for lowering low-density lipid LDL cholesterol level. HMG-CoA reductase inhibitors. Drug of choice for the cardiogenic shock with renal failure. Dopamine. Drug of choice for rheumatic fever. Benzathine penicillin. Drug of choice for increasing high-density lipid cholesterol. Niacin. Drug of choice for pulmonary edema with congestive heart failure, CHF. Furosemide, loop diuretic. Drug of choice for rheumatic fever. Benzathine penicillin. Drug of choice for tetralogy of Fallot, TOF. Morphine. Drug of choice for reducing motility in congestive heart failure, CHF. Spironolactone. Drug of choice for inotropic effect. Dobutamine. Drug of choice for a hypertensive patient with benign prostatic hyperplasia, BPH. Alpha-1 blocker like prazosin, terazosin, doxazosin, alfuzosin. Drug of choice for perioperative arrhythmias. Esmolol, cardioselective beta blocker. Drug of choice for hypotonic uterus. Oxytocin. Drug of choice for atrophic vaginitis. Topical estrogens. Drug of choice for cervical cancer. Cisplatin. Drug of choice for endometrial cancer. Medroxyprogesterone acetate. Drug of choice for ovarian cancer. Cisplatin. Drug of choice for mood change and premenstrual tension. SSRIs like fluoxetine. Drug of choice for reducing vascularity in fibroid uterus before surgery. GnRH analogs. Drug of choice for dysfunctional uterine bleeding, DUB. Medroxyprogesterone. Drug of choice for long-term contraception. Levonorgestrel. Drug of choice for vulvovaginal candidiasis in pregnancy. 1% clotrimazole. Drug of choice for generalized absence seizure. Ethosuximide and sodium valproate. Drug of choice for absence, petit mal, seizures. Valproate. Drug of choice for absence seizures in children. Ethosuximide. Drug of choice for myoclonic seizures in men. Sodium valproate. Drug of choice for myoclonic seizures in women. Lamotrigine. Drug of choice for focal seizure. Lamotrigine. Drug of choice for generalized tonic-clonic seizures, GTCS. Lamotrigine. Drug of choice for tonic-clonic seizures. Sodium valproate. Drug of choice for infantile seizures. ACTH. Drug of choice for rhinorrhea. Citrazine. Drug of choice for phobias. Selective serotonin reuptake inhibitors, SSRIs. Drug of choice for reducing pre-anesthetic anxiety. Lorazepam. Drug of choice for status epilepticus. I.V. Drug of choice for febrile seizures. Diazepam. Drug of choice for partial seizures. Carbamazepine. Drug of choice for attention deficit hyperactivity disorder. Methylphenidate. Drug of choice for Alzheimer's disease. Rivastigmine. Drug of choice for obsessive compulsive disorder, OCD. Fluoxetine. Drug of choice for drug-induced Parkinsonism. Benzhexol. Drug of choice for Parkinsonism. Ropinirole, pramipexole. Drug of choice for glioma. Nitrosourea. Drug which has pain relief properties without opioid disadvantages. Tramadol. Drug of choice for sedation in patients with severe liver failure. Lorazepam. Drug of choice for maintenance treatment of generalized anxiety disorder. Buspirone. Drug of choice for cerebral edema. Mannitol. Drug of choice for increased intracranial pressure. Mannitol. Drug of choice for psychomotor seizures. Carbamazepine. Drug of choice for mania. Lithium carbonate. Drug of choice for Huntington chorea. Tetrabenazine. Drug of choice for Parkinsonism. Ropinirole and pramipexole. Drug of choice for morning sickness. Hyoscine. Drug of choice for multiple sclerosis. Amitriptyline. Drug of choice for acute attack of migraine. Sumatriptan or ergotamine. Drug of choice for night terrors. Benzodiazepines. Drug of choice for atypical depression. MAOS inhibitors. Drug of choice for hydrocephalus. Glycerol or acetazolamide. Drug of choice for cluster headache. Sumatriptan. Treatment of choice for cluster headache. High flow oxygen. Drug of choice for infantile spasm. ACTH. Drug of choice for Huntington chorea. Tetrabenzine. Drug of choice for multiple sclerosis. Interferon B. Drug of choice for pulmonary edema. Morphine. Drug of choice generalized anxiety disorders. Diazepam, benzodiazepines. Drug of choice for pain and terminal illness. Morphine. Drug of choice for pain of acute myocardial infarction. Morphine. Drug of choice for chronic cancer pain. Morphine. Drug of choice for borderline personality disorder. Buspirone, 5-HT partial agonist. Drug of choice for neonate with respiratory depression due to use of morphine to control severe labor pain. Naloxone. Drug of choice for sedation in liver failure patients. Lorazepam. Drug of choice for decreasing anxiety in children preoperatively. Antihistaminics. Drug of choice for sedation in patients with porphyrias. Benzodiazepines. Drug of choice for trigeminal neuralgia. Carbamazepine. Drug of choice for status absence. Benzodiazepines. Drug of choice for convulsion in lidocaine-treated patients. Diazepam. Drug of choice for tardive dyskinesia. Diazepam. Drug of choice for convulsion in tetanus patients. Diazepam. Drug of choice for delirium caused by ketamine. Diazepam. Drug of choice for febrile seizures. Diazepam. Drug of choice for endoscopic and colonoscopy. Midazolam. Drug of choice for hypnosis in elderly. Zolpidem. Drug of choice for diabetic neuropathy. Topiramate. Drug of choice for neuropathic pain. Lamotrigine or topiramate or gabapentin. Drug of choice for reducing alcohol craving. Naltrexone. Drug for decreasing relapse of alcoholism. Acamprosate, NMDA receptor antagonist, or naltrexone. Drug of choice for alcohol detoxification. Disulfiram. Drug of choice for smoking cessation. Bupropion. Drug of choice for depression and Parkinson's disease. SSRIs like fluoxetine. Drug of choice for Parkinson's disease. Levodopa. Drug of choice for psychosis and Parkinson's disease. Clozapine. Drug of choice for depression. SSRIs like fluoxetine. Drug of choice for restless leg syndrome. Ropinirole. Drug of choice for violent behavior. Haloperidol. Drug of choice for psychotic depression. Loxapine. Drug of choice for neutropenia and Felty syndrome. Lithium. Drug of choice for patients with extrapyramidal symptoms, EPS. Clozapine. Drug of choice for negative symptoms. Clozapine. Drug of choice for treatment-resistant schizophrenia. Clozapine. Drug of choice for elderly with schizophrenia. Clozapine. Drug of choice for peripheral neuropathy. Lamotrigine. Drug of choice for bulimia. SSRIs like fluoxetine. Drug of choice for acute mania. Lithium. Drug of choice for serotonin syndrome. Cyproheptadine. Drug of choice for nocturnal enuresis. Desmopressin. Drug of choice for major depression. SSRIs like fluoxetine. Drug of choice for heat stroke. Chlorpromazine. Drug of choice for obsessive compulsive disorder, OCD. SSRIs or clomipramine. Drug of choice for sleepwalking. Carbamazepine. Drug of choice for cluster headache. Lithium. Drug of choice for cyclical vomiting. Lithium. Drug of choice for bipolar mood disorder. Lithium. Drug of choice for reducing hyperexcitement in acute mania. Haloperidol. Drug of choice for reducing excitement in chorea. Haloperidol. Drug of choice for reducing hyperexcitement in acute schizophrenia. Haloperidol. Drug of choice for reducing excitement in delirium. Haloperidol. Drug of choice for post-traumatic stress disorder. SSRIs like fluoxetine. Drug of choice for somatic pain. NSAIDs. Drug of choice for bipolar depression. Lithium. Drug of choice for depression with hypotension. SSRIs like fluoxetine. Drug of choice for depression with heart disease. SSRIs like fluoxetine. Drug of choice for depression with insomnia. Amitriptyline. Drug of choice for pain in aspirin allergic patients. Paracetamol. Drug of choice for gastroesophageal reflux disease. Proton pump inhibitors like omeprazole, pantoprazole. Drug of choice for duodenal ulcer. Proton pump inhibitors. Drug of choice for stress ulcer. Cimetidine, histamine H2 receptor antagonist. Drug of choice for dyspepsia. Proton pump inhibitors. Drug of choice for erosive esophagitis. Proton pump inhibitors. Drug of choice for duodenal ulcer. Proton pump inhibitors. Drug of choice for Zollinger-Ellison syndrome. Proton pump inhibitors. Drug of choice for morning sickness. Prochlorperazine, D2 receptor antagonist. Drug of choice for NSAIDs-induced ulcer. Proton pump inhibitors. Drug of choice for postoperative vomiting. Ondansetron, 5-HT3 receptor antagonist. Drug of choice for vomiting induced by cancer chemotherapy. Ondansetron. Drug of choice for radiation-induced vomiting. Ondansetron. Drug of choice for NSAID-induced gastric ulcer. Proton pump inhibitors. Drug of choice for peptic ulcer. Omeprazole. Drug of choice for vomiting in patients of Parkinson's disease. Domperidone, selective dopamine D2 receptor antagonist. Antiemetic drug of choice. Prochlorpromazine or metoclopramide. Drug of choice for children in constipation. Castor oil. Drug of choice for cleaning bowel before delivery. Sodium phosphate enema. Drug of choice for cleaning bowel for endoscopy. Polyethylene glycol. Drug of choice for constipation and chronic renal failure. Aluminium hydroxide. Treatment of choice for functional constipation. Dietary fibers. Drug of choice for bedridden patient with constipation. Phenolphthalein, contact laxatives. Drug of choice for stool softening. Dialkyl sodium sulfosuccinate. Drug of choice for irritable bowel syndrome IBS. Tegacerid, 5-HT4 agonist. Drug of choice for increasing motility. Mosapride, gastroprokinetic. Drug of choice for diabetic gastroparesis. Mosapride. Drug of choice for spasmodic abdominal pain. Drotaverine phosphodiesterase inhibitor. Drug of choice for pain relief and ulcer. Antacids. Drug of choice for diabetic diarrhea. Clonidine alpha-2 adrenergic agonist. Drug of choice for non-infectious diarrhea. Loperamide. Drug of choice for secretory diarrhea. Cholestyramine. Drug of choice for carcinoid syndrome. Cyprohepatidine. Drug of choice for inducing vomiting. Apomorphine via parenteral route. Drug of choice shortening gastric emptying time before surgery. Metoclopramide. Drug of choice for Mendelssohn syndrome. Metoclopramide. Drug of choice for vomiting in children. Metoclopramide. Drug of choice for inducing vomiting. Ipecacuanha. Drug of choice for laxative effect in patients with hepatic encephalopathy. Lactulose. Drug of choice for acute and chronic adrenal insufficiency. Hydrocortisone, shortest-acting glucocorticoid. Drug of choice for congenital adrenal hyperplasia. Hydrocortisone. Drug of choice for tumor-induced brain edema. Dexamethasone, long-acting glucocorticoid. Drug used for mineralocorticoid replacement. Fludrocortisone. Drug of choice for premenstrual syndrome. SSRIs like Fluoxetine. Drug of choice for dysfunctional uterine bleeding. NSAIDs, indomethacin. Drug of choice for androgenic alopecia. Finasteride, 5-alpha reductase inhibitor. Drug of choice for hypothyroidism. Levothyroxine. Drug of choice for hypothyroidism in children, cretinism. Thyroxine. Drug of choice for myxedema coma. Levothyroxine. Drug of choice for reducing thyroid gland vascularity. Potassium iodide. Drug of choice for hyperprolactinemia. Bromocriptine. Drug of choice for acute gout. NSAID, indomethacin. Drug of choice for chronic gout. Allopurinol, xanthine oxidase inhibitor. Drug of choice for thyroid storm. Propylthiouracil. Drug of choice for making patient euthyroid before surgery. Potassium iodide. Drug of choice for thyroid cancer. Levothyroxine. Drug of choice for Graves' disease. Methimazole, antithyroid drug. Drug of choice for thyroid ablation. Iodine 131. Drug of choice for thyroid storm in India. Potassium iodide. Drug of choice for reducing somatic manifestations of hyperthyroidism. Propranolol. Drug of choice for diabetic ketoacidosis, DKA. Regular insulin. Drug of choice for pheochromocytoma. Phenoxybenzamine, alpha blocker. Drug of choice for acute hypercalcemia. Furosemide, loop diuretic. Drug of choice for hypercalcemia due to malignancy. Bisphosphonate. Drug of choice for vaginal atrophy. Topical estrogen or HRT. Drug of choice lithium-induced diabetes mellitus. Amiloride. Drug of choice for steroid-induced osteoporosis. Zolindrate, bisphosphonates. Drug of choice for osteoporosis. Raloxifene, SERM selective estrogen receptor modulator. Drug of choice for prostate cancer. GnRH analogs like buserelin. Drug of choice for neurogenic diabetes insipidus. Desmopressin. Drug of choice for nephrogenic diabetes insipidus. Thiazides. Drug of choice for acute adrenal insufficiency. Hydrocortisone, I.V. Drug of choice for postprandial hyperglycemia. Nataglinide, maglitinide derivative. Drug of choice for type 2 diabetes mellitus, DM. Metformin, biguanides. Drug of choice for type 1 diabetes mellitus, DM. Regular insulin. Drug of choice for diabetes mellitus in pregnancy. Regular insulin. Drug of choice for uncontrolled diabetes mellitus. Regular insulin. Drug of choice for diabetic ketoacidosis. Regular insulin. Drug of choice for diabetes and renal and hepatic failure. Regular insulin. Drug of choice for controlling glucose level during infections and diabetes. Regular insulin. Drug of choice for diabetes and renal failure. Repaglinide, maglitinide derivative. Drug of choice for prevention of breast cancer. Tamoxifen. Drug of choice for prevention of diabetes. Metformin. Drug of choice for severe hypoglycemia in case of insulinoma. Diazoxide, potassium channel opener. Drug of choice for emergency contraception. Mifepristone. Drug of choice for polycystic ovarian disease. Clomiphene citrate. Drug of choice for oligospermia. Clomiphene citrate. Drug of choice for corpus luteum insufficiency. Clomiphene citrate. Drug of choice for anovulatory infertility. Clomiphene citrate. Drug of choice for postcoital contraception. Mifepristone. Drug of choice for hirsutism. Cyproterone acetate, androgen receptor antagonist. Drug of choice for large prostate. Finasteride, 5-alpha reductase inhibitor. Drug of choice for inducing labor. Oxytocin. Drug of choice for benign prostate enlargement, BPH. Tamsulosin. Drug of choice for postmenopausal osteoporosis. Raloxifene or bisphosphonates. Drug of choice for prevention of postmenopausal osteoporosis. Vitamin D and calcium. Drug of choice for chronic obstructive pulmonary disease, COPD. Anticholinergics, like tiotropium. First-line drugs for tuberculosis, TB. Rifampicin, isoniazid, pyrazinamide, ethambutol, streptomycin. Drug of choice for testing bronchial hyperactivity. Methacholine non-selective muscarinic receptor agonist. Drug of choice for pulmonary edema with congestive heart failure, CHF. Furosemide diuretic. Drug of choice for a vasodilatory shock. Norepinephrine. Drug of choice for persistent hiccups. Carbon dioxide. Drug of choice for apnea in premature infants. Theophylline. Drug of choice for exercise-induced asthma. Mast cell stabilizers like sodium chromoglicate. Drug of choice for aspirin-induced asthma. Leukotriene antagonist like montelukast. Drug of choice for starting treatment of asthma. Inhaled beta-2 agonist like salmeterol. Drug of choice for bronchospasm with chronic obstructive pulmonary disease. Ipratropium bromide. Drug of choice for smoking cessation. Nicotine. Drug of choice for liquefying plaques of sputum in patients with cystic fibrosis. Acetylcysteine. Drug of choice for temporal arteritis. Corticosteroid. Drug of choice for prophylaxis of exercise-induced asthma. Sodium chromoglycate. Drug of choice for pulmonary edema. Furosemide. Drug of choice for dry itchy cough. Codeine. Drug of choice for acute asthma attack. Salbutamol short-acting selective beta-2 adrenergic receptor agonist. Drug of choice for persistent asthma. Inhaled corticosteroid. Drug of choice for an asthmatic patient with hypertension. Amlodipine. Drug of choice for pneumocystis carinii. Cotrimoxazole. Drug of choice for suppression of cough. Dextromethorphan. Drug of choice for ACE inhibitor-induced cough. Aspirin. Drug of choice for asthma and diabetes. Ipratropium. Drug of choice for beta blocker-induced bronchospasm. Ipratropium bromide. Drug of choice for mild intermittent. Inhaled beta-2 agonist. Drug of choice for mild persistent. Inhaled low-dose corticosteroid or mast cell stabilizers or leukotrienes antagonist. Drug of choice for moderate persistent asthma. Inhaled corticosteroid with long-acting beta-2 agonist. Drug of choice for severe persistent asthma. High-dose inhaled corticosteroid with long-acting beta-2 agonists and oral corticosteroid. Drug of choice for poorly controlled asthma. Theophylline. Drug of choice for prophylaxis of asthma. Sodium chromoglicate mast cell stabilizer. Drug of choice for rapidly progressive glomerulonephritis, RPGN. Cyclophosphamide. Drug of choice for lupus nephritis. Cyclophosphamide. Drug of choice for nephrotic syndrome. Steroids. Drug of choice for steroid-resistant nephrotic syndrome. Cyclosporin. Drug of choice for steroid-dependent nephrotic syndrome. Cyclophosphamide. Drug of choice for urinary retention. Bethanochol. Drug of choice for enuresis. Imipramine. Drug of choice for hemorrhagic cystitis. Mesna. Drug of choice for patient allergic to thiazides and loop diuretics. Ethacrynic acid. Drug of choice for forced alkaline diuresis. Furosemide. Drug of choice for cerebral edema. Mannitol, osmotic diuretic. Drug of choice for malignant hypertension. Furosemide. Drug of choice for edema and liver cirrhosis. Furosemide. Drug of choice for hypercalcemia. Furosemide, loop diuretic. Drug of choice for edema and congestive heart failure. Furosemide. Drug of choice for edema and renal failure. Furosemide. Drug of choice for idiopathic hypercalciuria. Thiazide like hydrochlorothiazide. Drug of choice for calciuria due to hyperparathyroidism. Thiazides. Drug of choice for nephrogenic diabetes insipidus. Thiazides. Drug of choice for lithium-induced nephropathy. Thiazides. Drug of choice for hyperuricemia and renal failure. Allopurinol, xanthine oxidase inhibitor. Drug of choice for gout and renal failure. Allopurinol, xanthine oxidase inhibitor. Drug of choice for Lesch-Nyhan syndrome. Allopurinol, xanthine oxidase inhibitor. Drug of choice for urate nephropathy. Allopurinol, xanthine oxidase inhibitor. Drug of choice for alkalization of urine. Acetazolamide. Drug of choice for Conn syndrome primary hyperaldosteronism. Spironolactone. Drug of choice for secondary hyperaldosteronism. Spironolactone. Drug of choice for thiazide-induced hypokalemia. Spironolactone. Drug of choice for anesthesia of pediatric patients. Sevoflurane. The anesthetic agent of choice for daycare surgery. Propofol. Drug of choice for spinal anesthesia. Tetracaine. Drug of choice for surgical procedure in children. Ketamine. Drug of choice for inducing a child with congenital heart disease. Midazolam. Gas used for laparoscopic surgery. Carbon dioxide. Drug of choice for general anesthesia in patients with porphyrias. Ketamine. Drug of choice for local anesthesia in malignant hyperthermia. Procaine. Drug of choice for fast induction. Sevoflurane. Drug of choice for thiopentone-induced shivering. Pethidine. Drug of choice for induction and facilitating communication in psychiatric patients. Thiopentone. Drug of choice for lie detecting in criminals. Thiopentone. Drug of choice for surgery in patient with shock, sepsis, and hypotensive patients. Ketamine. Drug of choice for dental procedures. Nitrous oxide. Drug of choice for ENT surgeries. Nitrous oxide. Drug of choice for head and neck operations. Nitrous oxide. Drug of choice for obstetrical surgeries. Nitrous oxide. Drug of choice for maxillofacial surgeries. Nitrous oxide. Drug of choice for neurosurgical procedures. Isoflurane. Drug of choice for surgery in renal failure. Isoflurane. Drug of choice for cardiothoracic procedures. Isoflurane. Drug of choice for hypotensive anesthesia. Isoflurane. Drug of choice for epidural block. Bupivacaine. Drug of choice for spinal anesthesia. Lidocaine. Drug of choice for local anesthesia. Lidocaine. Drug of choice for patient allergic to lidocaine. Prilocaine. Drug of choice for prilocaine-induced methemoglobinemia. Methylene blue. Drug of choice for regional block. Lidocaine. Drug of choice for local anesthesia in cardiac patients. Mepivacaine. Drug of choice for local anesthesia in epileptic patient. Mepivacaine. Drug of choice for local anesthesia in hypotensive patient. Mepivacaine. Drug of choice for local anesthetic-induced cardiac arrhythmia. Bretillium. Drug of choice for reducing spasticity in multiple sclerosis. Baclofen. Drug of choice for spinal spasticity. Baclofen. Drug of choice for muscle relaxation in patients with renal failure. Atracurium. Drug of choice for muscle relaxation in patients with hepatobiliary atresia. Atracurium. Drug of choice for muscle relaxation in patient with hepatic and renal failure. Atracurium. Drug of choice for muscle relaxation for short procedures. Succinylcholine. Drug of choice for cholera. Doxycycline. Drug of choice for relapsing fever. Tetracycline. Drug of choice for syphilis. Penicillin G. Drug of choice for toxoplasmosis. Cotrimoxazole. Drug of choice for Legionella. Azithromycin or levofloxacin. Drug of choice for lymphogranuloma venereum, LGV. Azithromycin. Drug of choice for tropical sprue. Tetracycline. Drug of choice for Kala-Azar. Sodium stibogluconate. Oral drug of choice for Kala-Azar. Miltefosine. Drug of choice for chlamydia. Tetracycline-like doxycycline. Drug of choice for plague. Streptomycin. Drug of choice for brucella. Streptomycin. Drug of choice for Rocky Spotted Mountain Fever. Tetracycline. Drug of choice for tularemia. Streptomycin. Drug of choice for rhinoscleroma. Streptomycin. Drug of choice for actinomycosis. Penicillin G. Drug of choice for leprosy. Dapsone. The most effective drug against Mycobacterium leprae. Rifampicin. Drug of choice for tick typhus. Tetracycline. Drug of choice for herpes zoster. Valacyclovir. Drug of choice for herpes simplex. Acyclovir. Drug of choice for Scrubs typhus. Tetracycline. Drug of choice for influenza. Oseltamivir. Drug of choice for blood fluke. Praziquantel. Drug of choice for lung fluke. Praziquantel. Drug of choice for typhoid, enteric fever. I.V. ceftriaxone. Drug of choice for leptospirosis. Penicillins. Drug of choice for scabies. Permethrin. Oral drug of choice for scabies. Ivermectin. Drug of choice for filariasis. Diethylcarbamazine, DEC. Drug of choice for Listeria monocytogenes. Ampicillin. Drug of choice for Enterococcus faecalis. Ampicillin. Drug of choice for toxoplasmosis in pregnancy. Spiramycin. Drug of choice for schistosomiasis. Praziquantel. Drug of choice for leishmaniasis. Amphotericin B. Drug of choice for aspergillosis. Amphotericin B. Drug of choice for roundworm, ascaris. Albendazole, anti-helminthic agent. Drug of choice for pinworm, Enterobius vermicularis. Albendazole, anti-helminthic agent. Drug of choice for hookworm. Albendazole, anti-helminthic agent. Drug of choice for whipworm. Albendazole, anti-helminthic agent. Drug of choice for trichini worm, Trichinella spiralis. Albendazole, anti-helminthic agent. Drug of choice for guinea worm, Dracunculus mendensis. Albendazole, anti-helminthic agent. Drug of choice for hydatid disease. Albendazole. Drug of choice for filarial worm. Ivermectin, anti-helminthic agent. Drug of choice for threadworm, Strongyloides stercoralis. Ivermectin, anti-helminthic agent. Drug of choice for pork tapeworm, Taenius solium. Praziquantel. Drug of choice for beef tapeworm, Taenius aginata. Praziquantel. Drug of choice for fish tapeworm, Diphyllobothrium latum. Praziquantel. Drug of choice for dog tapeworm, Echinococcus granulosus. Praziquantel. Drug of choice for dwarf tapeworm, Hymenalepis nana. Praziquantel. Drug of choice for liver fluke, Facila hepatica. Triclobendazole. Drug of choice for community-acquired pneumonia. Clarithromycin. Drug of choice for surgical prophylaxis. Cefazolin. Drug of choice for pneumocystis carnii. Cotrimoxazole. Drug of choice for cholera in children. Cotrimoxazole. Second-line drug of choice for filariasis. Ivermectin. Drug of choice for tapeworm infestation. Praziquantel. Drug of choice for strongyloidiasis, threadworm. Ivermectin. Drug of choice for onchocerciasis, river blindness. Ivermectin. Drug of choice for tetanus. Metronidazole. Drug of choice for listeria. Ampicillin. Second-line drug of choice for listeria. Sulfamethoxazole, trimethoprim. Drug of choice for MRSA. Vancomycin. Drug of choice for vancomycin-resistant Staphylo aureus, VRSA. Linezolid. Drug of choice for neonatal meningitis. Ampicillin plus third-generation cephalosporin. Drug of choice for bactericides fragialis. Clindamycin. Drug of choice for pseudomembranous colitis. Metronidazole. Drug of choice for amoebiasis. Metronidazole. Drug of choice for trench mouth. Metronidazole. Drug of choice for bacterial vaginosis. Metronidazole. Drug of choice for amoebic liver disease. Metronidazole. Drug of choice for trichomoniasis. Metronidazole. Drug of choice for giardiasis. Metronidazole. Drug of choice for extraluminal amoebiasis. Metronidazole. Drug of choice for antibiotic-induced colitis. Metronidazole. Drug of choice for anaerobic infections. Metronidazole. Drug of choice for gonorrhea. Ceftriaxone. Drug of choice for H. pylori edication. Metronidazole. Drug of choice for whooping cough. Erythromycin. Drug of choice for cat scratch disease. Erythromycin. Drug of choice for Campylobacter infections. Erythromycin. Drug of choice for gonococcal urethritis. Azithromycin. Drug of choice for chancroid. Azithromycin. Drug of choice for legionellosis. Azithromycin. Drug of choice for trachoma. Azithromycin. Drug of choice for inflamed acne. Minocycline. Drug of choice for cystic acne. Isotretinoin. Drug of choice for urinary tract infection. Norfloxacin. Drug of choice for Plasmodium vivax. Chloroquine. Drug of choice for Plasmodium falciparum. Artemisinin in combination therapy, artesunate plus pyrimethamine plus sulfadoxin. Drug of choice for cerebral malaria. Artesunate. Drug of choice for malaria. Chloroquine. Drug of choice for chloroquine-resistant malaria. Artemisinin in combination therapy, artesunate plus pyrimethamine plus sulfadoxin. Drug of choice for brucella. Streptomycin with doxycycline. Drug of choice for candida. Fluconazole. Drug of choice for aspergillosis. Voriconazole. Drug of choice for dermatophytosis. Topically, azole, systemic, griseofulvin. Drug of choice for Chagas disease. Nifurtimox, benznidazole. Drug of choice for dysuria. Phenazopyridine. Drug of choice for gonorrhea. Procaine penicillin. Drug of choice for syphilis. Procaine penicillin. Drug of choice for rickettsial infection. Tetracycline. Drug of choice for plague. Tetracycline. Drug of choice for anthrax. Doxycycline. Drug of choice for toxoplasmosis. Trimethoprim sulfamethoxazole. Drug of choice for Haemophilus influenza type B. Rifampicin. Drug of choice for prophylaxis of tuberculosis. Isoniazid. Drug of choice for diarrhea in HIV patient. Octreotide. Drug of choice for acyclovir-resistant herpes. Foscarnet. Drug of choice for hepatitis B. Lamivudine. Drug of choice for hepatitis C. Ribavirin and interferon 2 alpha. Drug of choice for lava migrans. Albendazole. Drug of choice for inflammatory. Sulfasalazine. Drug of choice for prophylaxis of newborn to TB mother. Isoniazid. Drug of choice for accidental exposure of HIV to healthcare workers. Zidovudine with lamivudine. Drug of choice for salmonella. Ceftriaxone. Drug of choice for meningitis. Ceftriaxone. Drug of choice for gonorrhea. Ceftriaxone. Drug of choice for resistant pneumococcal infections. Ceftriaxone. Drug of choice for filarial worm. D-ethylcarbamazepine. Drug of choice for platyhelminths. Praziquantel. Drug of choice for trichomoniasis. Metronidazole. Drug of choice for extended-spectrum bacterial lactamase. Carbapenem. Drug of choice for otitis media. Amoxicillin. Drug of choice for nocardia. Sulfonamides. Drug of choice for neurosyphilis. Aqueous penicillin. Drug of choice for donovanosis. Azithromycin or doxycycline. Drug of choice for Neisseria. Ceftriaxone. Drug of choice for Cryptococcus. For induction, amphotericin. For maintenance, fluconazole. Drug of choice for neurocysticercosis. Albendazole. Drug of choice for typhoid, enteric fever. I.V. ceftriaxone. First-line drugs for tuberculosis. Rifampicin, isoniazid, pyrazinamide, ethambutol, streptomycin. Drug of choice for tuberculosis and renal failure. Rifampicin. Drug of choice for prevention of tuberculosis in susceptible individuals. Isoniazid. Drug of choice for treatment of tuberculosis in HIV-positive patients taking protease inhibitor. Rifabutin. Drug of choice for multi-drug-resistant MDR strains of tuberculosis. Amikacin. Drug of choice for latent tuberculosis. Isoniazid. Drug of choice for isoniazid-resistant patients of latent tuberculosis. Rifampin. Drug of choice for leprosy. Rifampin. Drug of choice for Lepro-1 reaction. Glucocorticoids. Drug of choice for Lepro-2 reaction. Glucocorticoids. Treatment of choice for multibacillary leprosy. Rifampin with dapsone and clofazimine. Drug of choice for hot water-borne tuberculosis in hospital, M.Zanopi. Clarithromycin. Drug of choice for cutaneous TB caused by atypical mycobacteria. Clarithromycin. Drug of choice for meningococcal prophylaxis. Ciprofloxacin. Drug of choice for meningococcemia. Ceftriaxone. Drug of choice for post-splenectomy sepsis. Ceftriaxone. Drug of choice for gram-negative sepsis. Piperacillin with tobramycin. Drug of choice for gram-positive sepsis. Vancomycin with gentamicin. Drug of choice for toxic shock syndrome, group A streptococcus. Penicillin with clindamycin. Drug of choice for necrotizing fasciitis, group A streptococcus. Penicillin. Drug of choice for prophylaxis of cardiac lesions and infective endocarditis. Amoxicillin. Drug of choice for impetigo. Penicillin G. Drug of choice for meningococcal meningitis. Penicillin G. Drug of choice for severe falciparum and chlorquinine-resistant malaria. Quinine. Drug of choice for Enterococcus faecium. Linezolid. Drug of choice for animal bite. Amoxicillin. Drug of choice for otitis media. Amoxicillin. Drug of choice for dirty wound prophylaxis. Cefazolin. Drug of choice for pneumococcal pneumonia in adults. Amoxicillin. Drug of choice for typhus fever. Chloramphenicol. Drug of choice for lice infection. 1% permethrin. Drug of choice for dental prophylaxis in infective endocarditis. Clarithromycin. Drug of choice for cellulitis. Oxacillin. Drug of choice for severe infection in penicillin allergic patient. Vancomycin. Drug of choice for microspore. Albendazole. Drug of choice for serious upper urinary tract infections. Aminoglycosides. Drug of choice for serious upper respiratory infections by atypical pathogens. Doxycycline. Drug of choice for endocardial prophylaxis in patients allergic to penicillin. Vancomycin. Drug of choice for histoplasmosis. Amphotericin B. Drug of choice for invasive streptococcal infection. Clindamycin. Drug of choice for dermatitis herpetiformis. Aspirin. Drug of choice for cryptococcus. Fluconazole. Drug of choice for vulvovaginal candidiasis. Fluconazole. Drug of choice for pyrazinamide-induced hyperuricemia. Aspirin. Drug of choice for systemic fungal infection. Amphotericin B. Drug of choice for CMV retinitis. Ganciclovir. Drug of choice for condyloma acuminata. Podophyllene. Drug of choice for microcytic anemia. Ferrous sulfate. Drug of choice for iron deficiency anemia in pregnancy. Ferrous sulfate. Drug of choice for warfarin overdose. Vitamin K. Drug of choice for heparin overdose. Protamine sulfate. Drug of choice for hairy cell leukemia. Cladribine. Drug of choice for chronic lymphocytic leukemia. Fludarabine. Drug of choice for chronic myeloid leukemia, CML. Imatinib. Drug of choice for chemotherapy-induced anemia. Erythropoietin. Drug of choice for anemia due to chronic kidney disease, CKD. Erythropoietin. Drug of choice for autoimmune hemolytic anemia. Prednisolone. Drug of choice for transient ischemic attack, TIA. Aspirin. Drug of choice for multiple myeloma. Melphalan. Drug of choice for heparin-induced thrombocytopenia. Argatrobin. Drug of choice for chemotherapy-induced leukopenia. Sargramostim. Drug of choice for chemotherapy-induced thrombocytopenia. Aprovecin. First-line drugs for multiple myeloma. Prednisolone, cyclophosphamide. Drug of choice for bleeding due to heparin. Pyridine. Thrombolytic agent of choice in acute myocardial infarction. Streptokinase. Drug of choice for arterial fibrillation-induced clotting. Warfarin. Drug of choice for prevention of stroke. Aspirin. Drug of choice for prevention of deep vein thrombosis. Low molecular weight heparin. Drug of choice for preventing bleeding due to thrombolytic therapy. Epsilon aminocapronic acid. Drug of choice for treatment of deep vein thrombosis. Low molecular weight heparin. Drug of choice for pulmonary embolism. Low molecular weight heparin. Drug of choice for anemia and chronic renal failure. Erythropoietin. Drug of choice for open-angle glaucoma. Prostaglandins analogs. Drug of choice for closed-angle glaucoma. Acetazolamide. Drug of choice for secondary glaucoma. Beta blocker like metoprolol. Drug of choice for inclusion conjunctivitis. Ceftriaxone. Drug of choice for trachoma. Azithromycin. Drug of choice for primary open-angle glaucoma, POG. Timolol. Drug of choice for xerostomia. Cevimeline. Drug of choice for corneal ulcer. Cyclopentolate. Drug of choice for hypertension with glaucoma. Timolol. Drug of choice for iridocyclitis. Atropine. Which beta blocker is the drug of choice in open-angle glaucoma? Timolol. Drug of choice for hepatic keratitis. Idoxuridine. Drug of choice for fungal corneal ulcer. Natamycin. Drug of choice for uveal herpetic keratitis. Acyclovir. Drug of choice for preventing meiosis during cataract surgery. Fluorbiprofen. Drug of choice for mild allergic conjunctivitis. Topical antihistaminics. Drug of choice for decreasing intraocular pressure before surgery. Osmotic diuretics like mannitol. Drug of choice for decreasing high intraocular pressure. Osmotic diuretics. Drug of choice for recurrent anterior uveitis. NSAIDs like indomethacin. Drug of choice for reducing intraocular pressure in diabetes. Osmotic diuretics. Drug of choice for breast cancer. Tamoxifen. Drug of choice for glioma. Nitrosourea. Drug of choice for colorectal cancer. 5-fluorouracil. Drug of choice for choriocarcinoma. Methotrexate. Drug of choice for pancreatic carcinoma. Gemcitabine. First-line chemotherapy for cervix carcinoma. Cisplatin. Drug of choice for the brain tumor. Lomustine. Drug of choice for prostate carcinoma. Flutamide. Drug of choice for insulinoma. Streptozotocin. Drug of choice for polycythemia vera. Busulfan or chlorambucil. Drug of choice for carcinoma of endometrium. Progestins. Drug of choice for Kaposi sarcoma. IF2 alpha. Drug of choice for B-cell chronic lymphocytic leukemia, CLL. Chlorambucil or fludarabine. Drug of choice for acute myelocytic leukemia. Cytarabine with mitoxantrone. Drug of choice for Wilms tumor. Vincristine with danctinomycin. Drug of choice for acute promyeloblastic leukemia. Retinoic acid. Drug of choice for hairy cell leukemia. Cladribine. Drug of choice for thyroid carcinoma. Iodine-131 with doxorubicin and cisplatin. Drug of choice for stomach cancer. Fluorouracil with cisplatin. Drug of choice for chronic myelogenous leukemia, CML. Imatinib or busulfan. Drug of choice for acute lymphocytic leukemia, ALL. Vincristine plus prednisolone plus mercaptopurine plus cyclophosphamide plus methotrexate. Drug of choice for ovarian cancer. Cisplatin with paclitaxel. Drug of choice for lung cancer. Cisplatin with taxane. Drug of choice for malignant melanoma. Dacarbazine. Drug of choice for testicular cancer. Bleomycin plus etoposide plus cisplatin. Drug of choice for advanced ovarian and breast cancer. Paclitaxel plus docetaxel plus cisplatin. Drug of choice for head and neck cancer. Cisplatin plus 5-fluorouracil. Drug of choice for small cell lung cancer. Cisplatin with etoposide. Drug of choice for glioblastoma multiforme. Temozolomide. Drug of choice for severe pancytopenia caused by anti-cancer drugs. Erythropoietin. Drug of choice for reducing anti-cancer drug-induced toxicity. Amifostine. Drug of choice for brain cancer. Nitocerias. Drug of choice for hemorrhagic cystitis caused by cyclophosphamide. Mesna. Drug of choice for increasing neutrophils in immunosuppressed patients. Lithium. Drug of choice for multiple myeloma. Vincristine plus adriamycin plus dexamethasone. Drug of choice for malignant meningitis. Methotrexate. Drug of choice for prophylaxis of CNS in case of leukemias. Methotrexate. Drug of choice for erythrodermic psoriasis. Methotrexate. Drug of choice for severe psoriasis. Methotrexate. Drug of choice for psoriatic arthropathy. Methotrexate. Drug of choice for severe erythrodermic psoriasis. Cyclosporin. Drug of choice for pustular psoriasis. Retinoid. Drug of choice for impetigo herpetiformis. Systemic steroids. Drug of choice for dermatitis herpetiformis. Dapsone. Treatment of choice for acute eczema. Moist compresses. Treatment of choice for subacute eczema. Creams and moisturizers. Drug of choice for impetigo. Mupirocin. Drug of choice for solar lenogenes. Tretinoin. Drug of choice for chancroid. Ceftriaxone. Drug of choice for pemphigus vulgaris. Prednisolone. Drug of choice for vitiligo. Corticosteroids. Drug of choice for atopic dermatitis. Topical corticosteroids. Drug of choice for severe exacerbation of atopic dermatitis. Systemic corticosteroids. Drug of choice for reducing recurrence of melanoma. Alpha interferon with vaccine. Drug of choice for lichen simplex chronicus. Corticosteroids. Drug of choice for seborrheic dermatitis and scalp. Selenium shampoo. Drug of choice for acne rosacea. Oral tetracycline. Drug of choice for tinea capitis. Griseofulvin. Drug of choice for the scleroderma-induced hypertensive crisis. ACE inhibitors like captopril, enalapril, etc. Treatment of choice for lichen planus. Topical glucocorticoids. Drug of choice for systemic dermatophytosis. Griseofulvin. Drug of choice for Stevens-Johnson syndrome. For immunoglobulins. Drug of choice for delayed hypersensitivity. Promethazine. Drug of choice for reversal of neuromuscular blockade. Neostigmine. Drug of choice for edema by liver cirrhosis. Spironolactone. Drug of choice for resistant edema. Spironolactone. Drug of choice for septic shock. Norepinephrine. Drug of choice for anaphylactic shock. Adrenaline. Drug of choice for steroid-induced osteoporosis. Alendronate. Drug of choice for erectile dysfunction. Sildenafil. Drug of choice for clonidine-induced rebound hypertension. Phentolamine, tolazoline. Drug of choice for congenital megacolon. Bethanical. Drug of choice for postoperative urinary retention. Bethanical. Drug of choice for paralytic ileus. Bethanical. Drug of choice for dystonia. Benzhexol. Drug of choice for akathisia. Propranolol. Drug of choice for the malignant neuroleptic syndrome, MNS. Dantrolene. Drug of choice for Wegener's granulomatosis. Cyclophosphamide. Drug of choice for hepatic encephalopathy. Lactulose. Drug of choice for cisplatin-induced vomiting. Ondansetron. Drug of choice for cardiac arrest. Adrenaline. Drug of choice for Sjogren's syndrome. Cevimeline. Drug of choice for postural hypotension. Midodrine. Drug of choice for levodopa-induced vomiting. Domperidone. Drug of choice for methotrexate toxicity. Folinic acid. Drug of choice for temporal arteritis. Steroids. Drug of choice for hepatic encephalopathy. Lactulose. Drug of choice for chronic suppurative otitis media, CSOM. Ciprofloxacin. Drug of choice for otosclerosis. Sodium fluoride. Drug of choice for tonsillitis. Penicillin. Drug of choice for pheochromocytoma. Phenoxybenzamine. Drug of choice for erectile dysfunction. Sildenafil citrate. Drug of choice for priapism. Adrenaline. Drug of choice for aortic dissection. Asthmalol. Drug of choice for perioperative cardiac arrhythmias. Asthmalol. Treatment of choice for dengue hemorrhagic fever. Platelets. Treatment of choice for dengue shock syndrome. Colloids. Drug of choice for Wilson disease. Zinc acetate. Drug of choice for neonatal meningitis. Cefotaxime. Drug of choice for Lambert-Eaton syndrome. 3. For aminopyridine plus pyridostigmine. Drug of choice for arthritis mutilans. Etanercept. Drug of choice for Guillain-Barré syndrome. I.V. immunoglobulins. Drug of choice for transverse myelitis. I.V. methylprednisolone. Drug of choice for chronic inflammatory demyelinating polyneuropathy. I.V. methylprednisolone. Drug of choice for Paget's disease of bone. Bisphosphonate. Drug of choice for postmenopausal osteoporosis. Alendronate. Drug of choice for edema by liver cirrhosis. Spironolactone. Drug of choice for a vasodilatory shock. Norepinephrine. Drug of choice for otitis media. Amoxicillin. Drug of choice for endometriosis. Danazol. Drug of choice for reducing vertical transmission from HIV mother to fetus. Nevirapine. Drug of choice for diarrhea and carcinoid tumor. Octreotide. Drug of choice for diarrhea in HIV patient. Octreotide. Drug of choice for hepatitis B. Entecavir. Drug of choice for suppression of premature labor. Isoxaprine. Drug of choice for short-term increase in blood pressure. Mephenteramine. Drug of choice for mountain sickness. Acetazolamide. Drug of choice for narcolepsy. Modafinil. Drug of choice for hypotension during spinal anesthesia. Ephedrine. Drug of choice for myasthenia gravis. Neostigmine. Drug of choice for low-tension glaucoma. Latanoprost. Drug of choice for bruxism. Botulinum toxin A. Drug of choice for blepharospasm. Botulinum toxin A. Drug of choice for priapism. Adrenaline. Drug of choice for pupillary dilation without cycloplegia. Phenylephrine. Drug of choice for motion sickness. Scopolamine. Drug of choice for morning sickness. Prochlorperazine. Drug of choice for vertigo. Cinnarizine. Drug of choice for ureteric colic. Diclofenac. Drug of choice for spasmodic pain. Drotaverine. Drug of choice for cholinergic crisis. Atropine. Drug of choice for hyperhidrosis. Atropine. Drug of choice for iridocyclitis. Atropine. Drug of choice for corneal ulcer. Atropine. Drug of choice for vagal-mediated bradycardia. Atropine. Drug of choice for sick sinus syndrome. Atropine. Drug of choice for preventing reflux laryngospasm. Atropine. Drug of choice for congestive heart failure, CHF. Dobutamine.